There is evidence to suggest that people with diabetes are being more affected if they have the COVID-19 infection. But to date, there's no evidence to suggest that people with diabetes are at increased risk of acquiring the infection. But once somebody with diabetes acquires infection, there's data suggesting that they have more worse outcomes, namely greater hospitalisation, more severe respiratory disease, and even higher rates of mortality. So the data we received from China, the original publications from Wuhan, report a mortality as high as 12%, which means 1 in 13 people with diabetes, where it was fatal. Now, of course, the mortality is very much dependent on which country and which health service you're in, and fortunately we can say in Australia the mortality rate is lower in general, much lower, in the order of 0.7 to 1%, and so far we don't have any Australian data for people with diabetes and COVID-19. So it is early to say much about diabetes here in Australia. We know that high blood glucose predisposes you to increased risk of infection, namely bacterial infection, and possibly worse outcomes. There are some data as well suggesting people with viral infection may have worse outcomes, and that relates to impacts on the immune system, in particular T cells. T cell function can be affected by high glucose, and this is a key plank of the immune system. We also know that people who have diabetes generally are older, and they also have potentially less organ function reserve, impaired heart or kidney function, which could determine the outcome from a virus. So really is multiple reasons for why they may have worse outcomes.